Is about Ebola, public trust, healthcare capacity, and government transparency. Yeah. So the U.S. government, I'm seeing over here, they're publicly defending plans for a proposed. They have defended plans for a proposed Ebola treatment and isolation facility in Laikipia County, insisting that the project really poses no danger. Yeah, and these guys are saying, Kenyans, you guys need to chill, man. Yeah. So they say that project poses no danger to nearby communities and it's meant to strengthen regional disease preparedness. Yeah, so I don't know whether we should believe, fam. Like, okay, the irony to me is this is the same America, literally, that withdrew USAID funding from African countries, and of course, us guys as well. Yeah, leaving many Kenyans jobless. And then now you're talking a big game saying that we should trust you guys. You guys. What ground you get that relationship died? And then another thing, guys, you need to know, Trump doesn't like African people, bro. Yeah, remember when he just checked in his first time, yeah, Alisa Manini, yeah, that this is a shithole. It's not me who said, it's him. Yeah, that man just doesn't like black people, bro. Yeah, so remember, there's crazy growing concern right now out here about the whole agreement, this whole engagement between, of course, Serikali ya Kenya and the United States government. Yeah, hakuna transparency. Yeah, you guys are discussing matters of importance, but you're not including stakeholders in that conversation. Yeah, Kenyans are not even really consulted. Yeah, so guys, we have every right to be skeptical. At the same time, experts also warning, I think we've talked about this, yeah, that this is a very rare strain of Ebola in native Bundibagyo, the Bundibagyo strain. Apparently, it causes severe disease and currently has no approved vaccine. Yeah, and that's why it's very important for us to actually heighten surveillance, rapid testing, and isolation facilities. Importantly, just like I think we've been doing. Yeah, so that one I have to shout out the Ministry of Health. Yeah, and then I'm also seeing over here KMPDU Secretary General Davi Adela. Yeah, amesema that Kenya's healthcare system is already overstretched. Yeah, there's a situation of staff shortages, delayed recruitment, and long waiting times. Kwanza, the queues in public hospitals, it's crazy, it's a menace, and I believe it's true. Yeah, our system is already stretched. Yeah, so can you imagine if Ebola now checks into the country? Yeah, you want to tell me our healthcare system as it is will sort out this disease? Right? And then you're talking about how, workers are not even enough. Healthcare workers are not enough. Right? Also, Kalonzo Musyoka jumped into this conversation. He has accused the government of secrecy over Ebola-related agreements and demanded full disclosure of any agreements involving quarantine armor treatment facilities. Yeah, so guys, another thing you need to know, just like the American government, yeah, those guys, first of all, have no regard for the law. Yeah. Literally. Yeah, and Trump goes against a lot of, rulings in their courts. Yeah, the man has no regard for their constitution. Same as the situation in Kenya. We just don't respect our constitution. We can go against court cases. Yeah, very fast. Yeah. Oh, another situation over here is Uganda's Ministry of Health has also confirmed 6 additional Ebola cases, bringing the total number of confirmed infections in the country to 15. It's crazy. In their country, of course. Yeah, so, guys, I think we're in a trap. Yeah, it looks like these guys are actually going to continue with the quote-unquote project. But you see, now the thing is, Kenyans actually do understand the importance of disease preparedness. That one is without a doubt. The problem, I feel like, is that you're asking us to trust institutions that are struggling. The healthcare system in our country is struggling to provide basic healthcare services. How many times have you seen women give birth on the floor? People sharing beds. Yeah? You're talking about queues, bana. When guys are going there to 6 services, queue ni refu sana, bana. Right? And then, of course, what the KMPDU Secretary General Atela Lisema. Yeah? Our hospitals are not really staffed. Yeah? We don't have enough doctors, nurses, equipment, and emergency response systems. Yeah? So it's one thing to tell Kenyans to trust our institutions in our hospitals. Yeah? It's another thing to actually be prepared. Yeah? Because just because you guys are building some facility in, Laikipia, it doesn't mean Kenyans actually trust this whole process. Kenyans don't trust our healthcare system. It just is what it is. You get? Yeah? So, guys, what are your thoughts, man? What are your thoughts on this conversation? 0719012600. The hashtag is also After Hours on Spice. 7:43 right now. Andrea Martin, let me return the favor. Tunikazi.